So the next topic is a very popular topic these days. It's yeast in the gut. So again, how do we recognize that that's a problem? Well, the most common symptom which we see is a craving for sweets. So again, sweats, yes, sorry. Bloating, acne, fatigue after eating, migraine headaches, hives, and eczema. So why it's a yeast? What's the problem with the yeast? So basically, the yeast is a part of our normal gut microflora. We all have yeast in the gut. But the problem starts when the yeast start to overgrow. And then the most problematic thing when it moves from so-called round forms to budding forms, so-called hyphae. And the hyphae, by all definitions, are virulent or pathogenic forms. So if the transition takes place in your gut, you're in trouble. So there are two different cycles in the yeast cells. The one, it's a common proliferation cycle. It's right here. So basically, this is a round form, and so a round form can create round form, and that's a normal process in our gut. But under certain circumstances, so the cycle gets kind of deviated from norm, and so the yeast start to form so-called budding forms or hyphae right here. And so this is a real hyphae right around here. And these are the forms which produce toxins, and these are the forms which are invasive, and they can cause quite a few problems. So that's the process which takes place in our gut, and that's what we call intestinal candidiasis, because this is all about candida. So the next problem is biofilm formation, which is a universal process in microbiological environment, but it takes place with candida as well. So candida surrounds itself with kind of gel-like structure, and because of that, antibiotics and other antifungal products don't penetrate well through that barrier. And because of that, the yeast problem and the budding yeast can exist for months and years. And again, this is completely gluten-independent process. It's a consequence of abnormal gut microflora, which can persist in a lot of patients who are completely gluten-free. So how do we deal with that? So this is our goal, and that's typically we're using food supplements for that. So first of all, stop feeding the yeast. So the yeast thrives on carbs, and so the first step is to lower carb concentration in the diet. So we recommend not only gluten-free but low-carb diet as well. Second, you need to digest all the food as completely as you can to prevent feeding the yeast. So that's why we recommend to use a combination of betaine hydrochloride, which acidifies your gastric environment and stimulates pepsin production, and digestive enzymes, which can completely digest your food and leave kind of the yeast very hungry, right? So the next process, which is normalization of gut microflora, it's a must because your normal gut microflora can suppress the yeast. And so for this particular reason, we're using probiotics and prebiotics. So the next thing is there are quite a few products which can reduce the yeast count in the gut. And so these products include probably well recognizable names such as Podarca, which is a very popular extract from Amazonian tree, rainforest tree. Wormwood extract, it's a Chinese product which comes from China, and the active ingredient called artemisinin. So berberine works extremely well against the yeast, as well as black walnut hulls. So in addition, we created in our clinic a product called candida. It's a combination of 4 different things. So we're using an extract from castor oil, so-called undecilenic acid, which is FDA approved to treat the yeast. Plus we're using EDTA, which breaks biofilms. And we're using 2 products from coconut oil. One of them is monolaurin, and the second product is caprylic acid. And so these are the products which can completely eliminate yeast from the gut. So the hyphae formation can be stopped with candida. And finally, biofilm formation can be stopped with candida serozymes and bromelain. These are enzymes which specifically break the biofilms. So, but one thing which I want to emphasize, it's a necessity of low-carb diet, because without the low-carb diet, you won't be able to fix the gut. And this is a typical pyramid which we're using to illustrate what the low-carb diet is. So the base of the pyramid is veggies and proteins, low sugar fruits. You can have various fatty products and nuts. Dairy products, typically recommend dairy products based on goat and sheep milk, legumes, and some grains. And mainly, you cut the carbs. Right? So the next topic which we'll discuss, it's a leaky gut syndrome. So a lot of physicians somehow think that leaky gut is a mysterious illness which cannot be well defined, which is the biggest mistake. So it's a well-recognized functional disorder of the gut. So when we're looking at our gut, so and this is kind of a picture of the gut. So there's epithelial cells which create a lining, and there are junction between those cells. It's called tight junction. And the nutrients from the gut can migrate through the cells and through the tight junction. And when the tight junction gets loose, you develop leaky gut. It's very straightforward. It's been described. There are laboratory tests which can measure. So again, it's a functional disorder of the gut. It's not a structural disorder. You cannot see it under the microscope, but you can measure it. So you can imagine that gut is a pipe with walls which are built with million living cells, which are epithelial cells, right? So, and the main component of the intestinal wall is to control the permeability through the tight junction. And you can imagine if this junction doesn't work well, you create a problem, which we call leaky gut. So what are the most common causes of the leaky gut? So it's a poorly balanced diet. Right now recognized that the diet based on high carb concentration creates a problem. Chronic use of alcohol. So no matter what kind of alcohol you use, you're going to end up with leaky gut, because apparently tight junction is controlled by the alcohol consumption, and it can be basically, it can create a problem if you use alcohol on a daily basis. Intestinal parasites, chronic candida obviously is another very common source of the leaky gut, and that's why symptoms of the yeast infection in the gut and leaky gut are very similar. So dysbiosis of normal gut microflora, and then we're talking about a bit more kind of rare things like chemotherapy, radiation therapy, prolonged use of antibiotics, chronic use of anti-inflammatory drugs, which as a rheumatologist I see all the time in my practice, including ibuprofen, naproxen. Any type of anti-inflammatory drugs eventually will result in leaky gut. The same is true for steroid hormones such as prednisone and methylprednisolone. And one thing which is not very well recognized, but it's a real problem, is chronic use of estrogens in the form of birth control pills or hormone replacement therapy. So if you use estrogen for longer than 3 months, you'll end up with leaky gut. It's pretty much given. So what kind of symptoms? Again, the symptoms of leaky gut are very similar to what we see in patients with chronic yeast infection. So bloating and abdominal discomfort after eating, diarrhea, which is extremely common, mucus in the stool. So fatigue, after you eat food you feel, I cannot function, I have a brain fog, I have fatigue. Poor tolerance of alcohol. So people who have leaky gut syndrome, every time when they drink even a small amount of alcohol, they feel completely drunk, and they have a very kind of prolonged duration of the feeling. As well as, acne, hives, and eczema, extremely common in people with gluten intolerance, with, leaky gut syndrome. So what happens if we don't treat it? So what are the long-term consequences? Again, celiac disease is a classical example of leaky gut syndrome. Colitis, yes. Crohn's disease, yes. Autoimmune hepatitis, spondylitis, rheumatoid arthritis, psoriasis, and psoriatic arthritis. All these conditions are associated with leaky gut syndrome, and it's been described in the 70s and 80s when leaky gut was recognized as the mainstream disease by mainstream medical community. eczema, hay fever, asthma, chronic sinus infections, diabetes, migraine headaches, and chronic fatigue. So you can see that our gut controls our whole body, and obviously if you have a problem with the gut, you may end up with a number of different problems in different areas of the body. So this is our recipe how to improve this condition, and again we try to segregate into two different groups. So number one is improvement of food digestion for a number of reasons. One of them, we're trying to normalize the gut microflora and prevent the yeast overgrowth. So we're using various digestive enzymes, which we discussed a few minutes ago. So normalization of gut microflora. So we designed probiotics, which we use more and more. It's called leaky gut probiotics. We put a strain, it's called Pediococcus, and Pediococcus kind of cleans up the gut from pathogenic bacteria. So we like using Bacillus coagulans, which is unique probiotic strain. It has very strong anti-inflammatory activity, and actually what is interesting that 2 years ago the study from Cleveland Clinic showed that appropriate use of Bacillus coagulans can stop rheumatoid arthritis from progression. It was a phenomenal study. Plus we're using various prebiotics such as glucomannan, mannan oligosaccharide, as well as fiber such as psyllium and apple pectin. And typically we like using a combination of probiotics and prebiotics together. So the next step is we need to normalize or optimize mucosal immune response. So how do we do it? So we're trying to use, again, probiotics such as mannan oligosaccharide or MOS. There's a unique product which actually was designed in San Diego, now it's produced in Colorado. It's called Epicor. So Epicor, it's an extract from the brewer's yeast, and it's been shown to significantly increase the level of secretory immunoglobulin A, and this is a molecule which protects our gut from intruders. So it's a unique product, and in clinical trials it's been proven to work extremely well for people with low IgA, or IgA, not complete but partial IgA deficiency. We also like using black urine seed oil, which is a kind of immune modifier, as well as bovine immunoglobulins, which are extracted from bovine serum, and sometimes extract from colostrum. Quake seed extract is a very popular product in our clinic. It's an inducer of so-called NK cells, or